Well, super. Well, thank you so much for everyone. I know it's been a long week, and I appreciate having as many people that are on tonight. Photography is something that we all really could, I think, learn always something. Anytime I'm hearing speakers talk about utilizing a camera, I know that I can pick up a pearl here or there. And one of the things when I was putting this course together was, what would I want to learn? And maybe what are some things that maybe you're not doing? When we talk about photography, for me, thank you, and thank you for filling out the poll questions. It is important because I think that, when we talk about, team members and ask, doctors, are they allowing their team to take the photos? One of the things that we know is that team a lot of times has more time. And so there's sometimes a lot of hurdles. And I've been there where you are. For those of you that are, having a hard time getting the team to pick up the camera and utilize it, tonight is going to be more about, the positioning of the patient. How do we have conversations with the patient? But most importantly, I'm going to talk to you about things that you probably wouldn't get from, outside of a doctor teaching a course. And that's what I really wanted to put together for you is, from my perspective as a dental team member, and then hearing from the dental team, what do they want to learn? But one of the things that I will say is it's not a cookie cutter. So if there's something that you have questions with, and also, anything throughout the course tonight, please know that, I will stop and answer that. And most importantly, I want us to have a good time, and I want us to learn from each other. So when we talk about photography, everything really starts with taking the photos. One of the most important things that we all have right now in our practices, with the economy, things getting hopefully a little bit better. But it's still hard at the end of the day when we don't have patients that say yes to the treatment plan. And we're going to talk a little bit about that. I feel like when we talk about photographs and we've got all this technology, we still maybe are missing a few pieces of the puzzle. And that's what I hope to maybe help you with tonight. And then I'm going to give you some things that are super easy, but I'm also going to tell you some things that, that sometimes are hard to hear when it comes to the photos. And I'm a realist. If any of you have ever heard me speak before, I'm going to tell you like it is. And I'm going to also tell you some things that we've done wrong. I worked for a lot of famous dentists. We took a lot of photos. We do a lot of photography. And I can tell you on a given day, sometimes we take anywhere from 400 to 500 images. So when we think about the photographs that we're taking, the beauty now is we do have digital, but we do a lot of sloppy photography. And I'm going to tell you, I am so picky about my photographs, to the point where the doctors were saying, hey, you know what? We're not even going to take the photos. There's times too when I'm lecturing with other people and they're like, Shannon, I know you're going to look at my photos on the screen here, so don't look at this and don't look at that. And the things that I want you to really think about as we go through our slides is, if you already know that, you shouldn't even show it, right? If you already know that your photographs are not where they should be, we got to do something about it. And so that's what I want you to really look at tonight and think about. I told you that I'm going to take you through some of the things that we've done wrong. And this is probably the number one case that we did not do what we needed to do for this patient. And I'm going to tell you that at the time I was brand new working in my practice. Yes, I'd worked for Ross Nash, I worked for John Cranham. I've taken a lot of photography, but it's not just taking the photos. What I feel, and I'm going to share with you wholeheartedly, that has drastically not only changed the way that I help my doctor present cases, but it is a missing piece to the puzzle. This is a patient that came in who actually, believe it or not, is a medical doctor. That's what's kind of crazy sometimes. We're so busy in our own profession taking care of people that we don't take care of ourselves. And sometimes we don't even take care of our team. And so this patient, when he came in, we go through full on records with every patient. I work for doctors that really believe that photography is the entryway to everything. And at the time, we didn't have a digital scanner. So this was several years ago. But what I will say is, taking the photographs and making sure that we're capturing everything, we felt in our hearts that we did everything right. So when you look at this patient and we see and we know that, this is attrition. Attrition's when we fiddle with our teeth, the wear, and I am this patient. but taking the photographs and going through a series, and where you're going to hear me tonight talk about specific series and where do we fail when it comes to photography, is not having systems for those photographs, but going through the photographs and really taking the time to show patients those images. A lot of times we're taking the photos, we're popping them up on a screen, but do the team really know what to say? Have we, are we all on the same page? Are we looking at photographs and really going through, I should say this with each image? And I feel that, again, in my own practice, this is where we fell short. Everybody took really good photos at the end of the day. You can train me to take good pictures, but I'm going to say things just, that are going to be very different from my team members unless we're all taught this is really what we should be saying with each image. And so I think that is something tonight that I'm going to be able to bring to you to the table. When we look at these mirror shots, and I honed in really closely, these one-to-ones, you'll notice that one of the things that we'll see is we're seeing Denton, right? And we know just from all the occlusion courses that I have taken and working for John Cranham and Pete Dawson, once we get through the enamel, this wear is going to happen so much faster. But with photography, if we don't have systems where, as your assistant, as your hygienist, I know that when a patient comes in for a new patient, I'm going to take these photos. When they come in for the next appointment, I'm going to take these pictures. And really going through and knowing every single time and not just saying, well, you know what, Shannon, at this appointment, you know what, today, just go ahead and take a full face and a couple of mirror shots. Every time it is the same, we won't capture what we need to for you. And there are going to be times that we're going to miss those images. When we've got systems of photographs and we know what we're going to be taking, as your assistant, as your hygienist, every appointment, we're not going to miss it. With this patient, I also want to make sure that we're showcasing these images, and I always relate things to food. The whole reason why we're taking photographs is to show the malocclusion, and we know that there's a high percentage of just about every patient we're going to see throughout the day that's going to have this, but we got to take the time to show it to them. But most importantly, when we show patients the photos, do they say yes? Most of the time, it's something that maybe they need to think about. Maybe they didn't understand. But there's a lot of things now we do different. See, this patient, when we presented the case, and yes, I'm a very good presenter with my doctor. I have probably close to a 98% acceptance rate. But I'm going to tell you, I didn't have that from the very beginning. There was a lot of things that we missed. And this is one of those patients that we missed. As we were presenting the case, we gathered all the records. But one of the things that I think is we probably didn't give enough information, but most importantly, we didn't really know what type of person this patient is. See, we can't dissect every patient. We can't do a disc profile on every single person to know how are they going to take the information and really retain it. They could be someone that maybe needs to listen, maybe they're visual, maybe there's someone that needs something in their hand, and maybe it's someone that needs to have it written down. And so in dentistry, I think we think we gave them what they needed. They tell us yes in the chair, but then they stand up and they walk out of the office and they don't accept the treatment plan. A lot of times we say, well, what did we do wrong? What did we miss? So one of the things that I feel is probably the most important thing that we have to really back up a little bit is we can't really know from the very beginning with these patients, how are they going to retain the information? We took the photos, we showed them, but we didn't give them anything. And this particular patient was a visual patient, but also someone that needed something in their hands. And I know for a fact that this is what we were missing. And we're going to talk a lot about this tonight. So when you look at this patient, and we're talking to him, again, my doctor was giving him the treatment plan. He leaves. He doesn't come back. Comes back 5 years later. And I want you to look at where he is now. We missed it. One of the things that I talked with Dr. Corman about this patient, I said, oh my gosh, we're so busy. They leave. Not only did he fall through the cracks, but one of the things that I feel is there was a lot of things that we gave him. Sometimes we might give him too much information, right? You can take it all the way to the other end. But the one piece that I know we missed is we didn't really know that what we were giving him was going to be retained. It wasn't. And I feel like if we probably would have printed these out, and you're going to hear me tonight, if you're going to take the photographs, now more than ever, there's so many statistics of people that we can show video, we can do digital scans, we can take the images. But if you still give me something in my hand that I'm going to walk out with, I'm going to remember it. So not only are we going to scan patients, we're going to take photographs, we're going to have the conversations, and when we're finished at the chair, we're going to talk about what do we do? How do we give the patient something that's in their hands, and we also email them or text message them the photographs. And we're going to walk through some of this tonight because every one of us knows there's always things that we could have done different. There's always things that maybe we could have said better. But the one thing that I will say is, when we've got this technology and we're doing everything we feel we're doing right, there's something that we're missing. And maybe we just didn't know enough about who that patient was to understand that maybe we should have printed them out. Maybe we should have sent the text messages. Maybe we should have, showed them the video because we know people don't read. But at the end of the day, this patient's going to have every single tooth restored. We might not have had it done that if we would have gone back to this image and maybe stopped this wear. But the one thing that I know, and so does Dr. Corman, is, you know what? If we would have known what we know now back then, we wouldn't have wasted 5 years of tooth structure. So what I want to make you aware of tonight is photography will take you everywhere. The team and everyone needs to know how to take photography. Now, one of the things that I put in the slide is because, we've got to think about, what we're seeing right now. These are fresh numbers, just so you know. I just did an occlusion course. I love occlusion. But I'm going to tell you that I know that it's really important for us and the team to understand that we have to take photographs on every single patient so they can see what we see, not just hold a mirror, but we need to take full series because there's images that really will relate to the patient more than others. And one of the things that my team also wanted them to understand is we were waiting to talk about occlusion for older patients, but now what we're seeing is these children, 6 to 11 years old, that have malocclusion. Teens, more than 1 in 2 need orthodontics. And I will tell you, adults, 60% have clinically relevant malocclusion. I think those numbers are low. This is where I feel like, you know what? I think that's low numbers. But we need to start young. We need to be taking photographs on everybody. And how do we get the team to really buy into that? Now, one of the things tonight is, yes, Shofu is my sponsor, but let me tell you, Shofu didn't come to me. I went to Shofu because I have 5 Canons, 2 Nikons. I got 7 Shofu cameras. I'm a realist. And at the end of the day, we know for doctors that are on this tonight, not every team member is going to pick up a camera and really buy into changing settings and understanding the parts of the camera and really take it and run with it. Most team members will give us the Heisman to the point where I can tell you my own team members wanted me to be fired when I said we're going to start taking photographs. So what I'm going to take you through tonight is why are we taking them? We already know that. It does convey emotion. No matter what we do, emotion is everything. And until we take photographs and people see it, but most importantly, they hold that image in their hand, it's nothing. It doesn't relate to them unless we see it in color. And I think this is something tonight we're going to really learn. It is the first impression. People think we're high tech. If you don't have a digital scanner, but you've taken photographs, you still are looked at as high tech. Because I can tell you that the courses that I give, this year alone, I've already taught 14,000 dental team members, and less than 60%, maybe 50% now, still don't have a camera. They're still not taking photographs. It's not the same as an intraoral photograph. Now, what I want you to understand for those that maybe don't have a camera is, I try to think about how would I feel if I were the patient? You're putting an intraoral camera in my mouth. This is the top of the tooth, the front of the tooth. And what would really drive me crazy is when I would open up, our images and look at all the photos. And I can tell you right now, if they weren't noted, oh my God, every tooth is just a run-on tooth. Where for me, photography is very important, and we have to make sure that every team member is doing it. And at the end of the day, there's going to be people that are going to tell you, no, I don't want to do it. But you know what? it is really more dentistry will come from the photographs than anything else we're going to do. And so it really has the ability to have that perceived value. But it's what are we doing with it? If you're taking the photos, what are you doing with it? And that's what I want you to really ask yourself the question. Tonight's not about selling cameras. I can tell you, I've probably sold more Shofu cameras than any speaker for Shofu. I've sold over 600. Why? Because you know what? Team members, they really don't want Canons and Nikons. Now, I can tell you right now, I told you how many I have. I teach with them if I'm shooting things in RAW, but team members, if you're not giving lectures, we want something they're going to pick up and they're going to use right away. And it's got to be easy and it's got to be simple. And that's why I have 7 in my practice. So let's talk a little bit about the differences in these cameras. And I'm going to tell you what they're going to say. If you have Nikons and Canons, I'm not here to sell you on cameras. I don't get paid by Shofu to sell you cameras. What I'm here tonight is to educate you on those images. But I will say that, again, I have Canons, I have Nikons. The one thing, if you do have them, is a couple of things from a dental team member's point of view is have your team members know the settings, have the guides. Tonight, I don't have a lot of time to go through those settings, but I have them. And if you want them at the end of the program, you're going to have my email address. I'll send you the settings. We've set everything up for Nikon, everything up for Canons to make it super simple. But most importantly, making sure your team has a neck strap because that's going to build confidence. Because the number one complaint are these cameras heavy and they don't have the time. And we got to get over that. The other thing is, knowing the settings. One of the things that we have is we're going to give you these guides. For me, I have to have visuals just like a patient. I want guides and understanding those settings because what happens, and even in courses when we are taking Canons and Nikons, everybody messes up the settings. They need to understand a little bit more about the camera. But the beauty of utilizing a point and shoot is a lot of times we don't have to worry about that. And so this is where, again, I want you to have everything that you need, but tonight is going to be more about the settings. When we think, or more about the images, when we think about the settings though, again, I always tell my team members the low numbers on Canons and Nikons, we need that for full face images. When we get into going up higher, 8, f-stop 8, f-stop 22, f-stop 32, we're going into the mouth where things are dark and we need more light. And so things will become crisp and clear. And this is where, again, team members need to know because sometimes we'll forget to change the f-stops and we start to see things a little fuzzy and we need to be aware. Well, if you start to see those things change, you might have forgot to change the images. And so this is where, again, having guides, having systems, and most importantly, let me give you those for your team to use. The other thing is going back to systematic approaches. Again, as a team member, I will tell you that when I came to work for Dr. Cranham, I worked for Ross Nash. We took bukus of photos and everything was the same. Every time that person sat in the chair, they knew we were going to take our photographs. Patients have to be trained, and we got to train them. The one thing that we utilize with a lot of our software with Weave is we are already letting new patients know we're going to be taking photographs so we can, help relay what we see to you, but most importantly, insurance companies, laboratories, the communication. We have all kinds of things that we're putting together to train our team and most importantly, train our patients before they come in the door to know we're going to be taking the photos. But the team needs to know what are those photos every single time. And the one thing that Dr. Cranham didn't do is we didn't have that system every time someone walked in the door. My team knew we're going to be taking this series every single time, no matter what. So if they came in for pre-op, they came in for a prep, they came in for us to check the temporaries. When they came in for us to do the removal of the temporaries, we're going to take those photos, same pictures every single time, because the more photos we take, the better we're going to be. But the one thing that I will say too with Dr. Cranham, it doesn't mind me telling you, I said, how can I talk about your photographs if I've never experienced records? I never had the retractors in my mouth. I didn't have that mirror crammed to the back of the throat. I didn't know how the mirror was going to feel in my mouth going in and out. And when I experience what it feels like, I'm actually going to be a better clinician. So one of the things that I want you to know is when I ask dental team members, well, have you been through records? Have you had photographs taken on you? Do you know that probably the same amount, 50% will tell me no. So how can I be the best clinician to help you if I haven't gone through the record? So I want to encourage you to not always take your staff meetings, your team meetings, and talk about money. let's do a little bit of education and maybe take one of those and let's get photos on each other and let's critique it. The one thing we do in our courses, when we take the photos, we critique it and we tell our team what they did right, what looks good, and then they got to go back and retake it. Because if you never tell me what is wrong, how am I going to do better? A lot of times in dentistry, we just tell the team to go back and retake it. No, that's not good. Or sometimes we don't say anything. But I'm not going to be as good as you want me to be if you don't tell me, Shannon, let me tell you why this is bad. These are good, but let me tell you what I see. And I want you to go back and retake it. Because when you make me retake it, again, critiquing me again, I'm going to know. But when we've got guides, and if you don't have this, listen, if you don't take photos, that's why I wanted to know. And I want to look at the poll before we leave tonight. How many of you are taking photos, but how many of you are taking them yourself? Because you can't do everything. You got to let things go and let the team do it. But most importantly, I need to know what is expected of me every single time. You don't want to tell me in a prep, maybe in the huddle that morning, which is what, some doctors will do. They'll say, hey, with this patient, just grab a smile and retracted views. Well, guess what? I am not going to follow the protocol every single time. And so if you don't have that, and maybe you haven't been taking as photographs or that many photographs yet, out of the gate, we don't want you taking 18 pictures. We want you to get good with really maybe 6, maybe 8, maybe 4. And in my practice right now, these are the ones we take along with the mirror shots, but my hygienist will take a series as well every single time. And they know that that is expected, or every other time we see the patient. And so this is where I want you to really have those systems. And if you don't have guides like this, then I'll give you mine and you make your own, or you let me help you make them. But that's important. When we talk about cameras, though, and why I love the Shofu camera, I'm going to share with you tonight why, because it's super easy. When we jump right into photographs, and that's what we're going to do tonight, we're going to jump right in and we're going to talk about it. There's a lot of different modes, and we're going to talk about why do we use these, and most importantly, how do we get the best images. The one thing that I love about the Shofu camera is you can wipe it down with a cavi wipe. It's touchscreen. It weighs 2 pounds, and most importantly, it has all these modes, and everything is touchscreen. We don't have to worry about f-stop 22, f-stop 8. Face is face, so it makes it super easy for the team. And I can tell you that all these modes, I don't even use in my practice. I use full face. I'm going to use my standard modes. And depending on the light that's in my op, I might use mirror mode. And most importantly, I'm going to use an isolate mode. So these modes are really great to have. And I'm just going to kind of skim through this a little bit. You're going to have the entire videos because we're going to make sure you get it.
Intraoral images. I've got standard, surgery, mirror, face, which we already talked about, low glare, whitening, telemacral, and isolate mode. And we'll talk more about these two when we talk about our laboratory communication. They will come in handy there. But let's make it really simple. I will tell you that low glare, I never have had to use. That would really be if you've got a lot of lighting, and you've got this bounce of light, okay? I don't really use that one. I'll use face and I'll use standard. You could use mirror mode, and I'm going to share with you what is the difference. But what I find is I really only need those two. This is why it's so simple. Face and standard. So let's push it to standard, and now we're going to get our smile shots. So let's go to it. So what I'm going to do here is remember that with SLR cameras, and we're going to talk about that, we're setting a number and moving our body in and out to focus. The one difference about this camera, it's a point and shoot, is that we'll never know that that number is the same further away. So I'm really going to just judge by the fact that I can see a little bit of tissue of her face. I always want the same distance from her lip to the nose and her lip to the chin. This is not a nose shot. This is not a chin shot. I want to be focused on her beautiful smile. What happens is a lot of times I'll see team members, they have pretty much all of this area. And what happens, the patient will be focused on things that they really should not be. Remember, we want to see the teeth, not the face. Now, Kylie, what I want you to do is...
So a couple of things we want to just kind of mention here. Full face photos are super easy. All of us can get full face photos. I'm not going to waste your time on that tonight. What I want you to understand, though, is you notice that she is standing with her arms to her side. It's one of the things that I see a lot when patients put their hands in front. Where we may have a little cant. So I always tell people, hey, listen, have your patient stand straight up, put their hands out to their side, because what that does is it gives us a stance, but most importantly, things are nice and straight across. The one thing about all the cameras nowadays is that we have grids, so we want to make sure we can use those grids, but most importantly, being very picky about what we see. Now, when we do that, and I'm going to kind of get through this just a little bit, I'm going to, I put my hand almost like I'm shaking someone's hand. That's how you're going to hold, that's how we hold this camera. But most importantly, when I'm doing my full face photos now, I actually will go ahead and take the smile shot with the patient standing up, because they're already there. So if they're standing up and I'm already doing the full face photos, I'm going to go ahead and change my screen or change my dial to my standard, or if you're going to use your other cameras, doing that. But I'm going to go ahead while they're standing and just go hone right in to that smile and capture it. And again, remember what I said. If I go through, and I'm just going to kind of jump back and we'll come back to it. If I go through and I look at having, again, the smile shot and making sure that, I'm going to capture that. And I apologize, I'm going to go back to this really quickly. I want to make sure that when I do this, that I am not, leaving anything. So when I look at the smile, and I'm going to just back up just a little bit, I want to make sure that I have the same distance from the upper lip to the nose, lower lip to the chin. And this is where you got to tell the team, listen, split the difference and don't cut off the corners of the smile. We see this a lot. So we want a really nice smile, and we want patients to almost, exaggerate. Okay, I know it's gonna be kind of cheesy, Kylie. Go ahead and smile really, really big and capture that smile. Now what we're going to do is, once I've done that, I will go ahead and put them into the chair, and now we're ready to do the retracted views. There have been times when I'll go ahead and use the retractors right there while they're standing too. It just depends on the patient. But most of the time, I'm going to go ahead and I'm going to bring them over to my chair. Now, when we talk about full face, again, if you're going to do full face images, I want to make sure I don't cut the top of the head off. I want a really pretty smile, and again, making sure that from the shoulders up. And we do go through the series of smile, full face, repose where they're not smiling, and then also our side views are very easy. But let's jump into some of the harder ones. Retractors.
Shots, but a lot of people just stick with the same retractors. Notice that they're metal, okay? The other thing is when you put these in the mouth, they're cold. And they're a little bit cold, so she's gonna put them in and she's gonna feel that today. The other thing is that I wanted to share with you how we're going to get a collapse right in the center, very different than what we had with the clear. My eye is going to want to go to those wires, and that's what.
So this is where, when we talk about here in just a few minutes, what are we using? When we take the smile shots and we're going to jump right into the retractors, a lot of people that I see are using wire, and I understand it, right? They're using wire because it's just one type of retractor. We're going to get into that before we close tonight. You've got to have both. If you really want to up your game, you cannot use wire retractors for everything. First of all, I have every tooth in my mouth is porcelain. It's like nails on a chalkboard. But what I want you to understand is, when we think about perfection here, and again, looking at really good images, the lip will collapse. And we're going to show you this with Kylie, because when I put this in for her and she's putting in the retractors, and we're going to jump right into it because I don't want you to have to listen to my voice. We're going to put them in. But what I want you to see is we're not going to have the same look by using these.
A lot of people just.
So when we put them in, again, the patient is going to hold them. One of the things that I do not want is, I do not want a doctor and an assistant taking these photos. I can take them by myself when we're trained, and you can be in a room prepping while we're taking the photos. So here, Kylie is my assistant. So when we do this, one of the things that we're going to jump into is she's going to be holding these, right? So when she's holding them, again, I want you to kind of look at it. It's an ugly image. It's not pretty. So when we think about that, and again, I'm going to just kind of back off just a little bit. When you look at it and she's putting them in, it's not a pretty image. And so I'm just going to kind of let it play for a little bit so you can see it. But what I feel is, this is not what we want. I don't like wire. One of the things that happens is the lip will collapse. And again, it's not pretty. Everything will open up so much better if we jump to our clear retractors, which is what we're going to do. So when I look at that and we put in the clear retractors, the first thing that we want to make sure of is, what images do you want? Do you want images where, and we're going to put them in and they're going to bite together? we take that, and there are images when we, have them separate their teeth where we could see the chips on the edges or see the incisal edges. But here, what we really want, you to really look at is we have those wire ones. They're not pretty. We want to use clear because the eye doesn't go to the wire. The eye is going to go to the teeth, and that's what we want patients to go to, right? We don't want them looking at everything. We want something that's really nice, pretty, clear, and getting the lips out of the way. But going back to what we said, the same distance. We don't want sloppy photos. We want to really make sure that everything is nice and straight across. And if it's not, you need to tell me to go back and retake it. This is where we got to make sure you're telling me, because again, it's digital. We can retake it in seconds, but we're going to slip in those clear retractors and again, really focus on the center of 8 and 9 and making sure that those are really good images. So this is where, again, I want to make sure that you're doing it. Now let's jump back to our video here and let's just jump right into what happens when we've got our retractors. So here, what I'm doing with Kylie is she is going to be sitting straight up, and I'm just going to hit play here and go back to that. But what I want you to really think about is as we're going through, and she's got the wire, we've already done that. We're going to jump to the chair. And I'm just going to kind of pick up my camera, and she's sitting on the edge of my chair. I want to make sure that my chair is the same level so I'm dead on with her. And if I'm taking that smile shot, I want to have it nice and straight. And again, I told you, you can either do it when they're standing or you can do it when it's in the chair. But I like to do it, a lot of times while they're standing. Now what we're going to do is we're going to slip in those clear retractors and we'll have a really good photo. Now, let's get to the hardest images yet, right? And that's the mirror shots.
The hardest to get. Our next photos are going to be the mirror shots, and we know in dentistry, those are the hardest to get. 90% of the time, the reason that it's hard for you to get those are sometimes we're utilizing different retractors. We may still think we can use these plastic ones, but we can't. We have to switch to the wire, and I'm going to share that with you in a minute, why the wire is so important, okay? The other thing is that a lot of times what we'll see is your positioning, the clinician's positioning, because we're trained that ideally patients sometimes will be sitting far up into the chair and we're going to come in front. And I want to share with you why that's bad, okay? So if I ask my patient to hold the retractors, you might be using these already, but if I slip them in, a lot of times patients will do this. We want to bring it at an angle, but let's just pretend our patient, I'm going to have you hold these for me, okay? And just like that. I'm going to come in front because this is how I originally was trained, okay? So if you can imagine that she's going to be sitting up and I come in at an angle, what's going to happen? I'm cutting off the molars and we can't really get up in there with our camera, right? I don't want that. The further away we are from the teeth, the more images will be in the frame. So let me show you that. So now I've laid her back. Notice the top of the chair is really at my waist. What I want to do is be able to take my camera and get it up and over and in. The other thing is notice she's really down in the chair. I want to pull the patient up and I want you to scoot up some more in the chair. Reason being is because I want her to be able to lift her head so I can get in there. Okay, you can see that. So Kylie, what I want you to do is just lift your chin really high, okay? And I'm going to have you hold these retractors. Now I'm going to slip them in.
So the one thing that we have with patients a lot of times is, they got that wild tongue, right? Or they're not really, they want to tuck their head down. The higher they lift their chin, the further back the tongue is going to go automatically. The other thing is like I said, I don't have another person in here. People say, well, Shannon, what about the mirrors? If you get in there, how do you keep your mirror from fogging? Well, guess what? You just told on yourself. The more photos that I take, the faster, the more efficient I'm going to be with the images. And I don't need to worry about like Butler dip or having a heating pad or hot water. I just don't need that because I've taken enough photos. Everything in dentistry is repetition. The more I take, the better I'm going to perfect my skills and I'm going to be able to get in there and not have to have any of those things. And again, when I was trained, I used to come in front because that's how I was trained. if you get behind the patient and again, having the retractors, having them pull them straight up into a V, and we use a really good mirror, we're going to put the mirror in. But again, the further away the mirror is from the teeth, the more teeth are going to be in the frame. And so this is why this is really critical. The most critical images are these, the mirror shots. Anybody can take a smile. This is where we really want to make sure that our team understands we've got to get behind them, and taking those mirror shots will really give us the best images. But most importantly, I don't want to cut off the last teeth. I see that a lot. And again, if you're the doctor, you're treatment planning the last tooth, but I don't even have it in the frame. I need that. So we're going to get behind them.
And I want you to hold them almost like a V, okay, and come out a little bit further. There we go. If she was like this, I might not be able to get the mirror in as well as I would want to. So we're going to have it just like that. The next thing is, notice I'm using this mirror, and we'll talk more about this later, but it's got a rubber handle, so I got a better grip on it, okay? I also, again, the further they lift their chin, guess where the tongue is going to go? Back, right? So I'm going to slip this mirror in, and Kylie, wide, wide, wide. Notice it's flat against the occlusal teeth, flat. Not in an angle like this, like we would do if we were in front of her. We're going to do it flat. I'm going to look and make sure that I am straight. If I'm at an angle, I'm not going to be parallel.
Now let's talk a little bit about SLR cameras here. If you have a camera that has a ring light or has the flash, I can tell you that it's got to be parallel. You got to make sure that light is parallel, and making sure that when you're standing behind the patient too, again, they're front heavy, right? A lot of times a ring light, I could find myself kind of going this way. The beauty of having, an LED, and this is an LED, I'm going to hit the button, light up everything, and then I'm going to come in at an angle. But most importantly, when I put that mirror in, I'm going to push on the patient a little bit to crank them open. Believe it or not, you're not hurting them. You're basically actually helping them to have a fulcrum. So we're going to open them up more. Notice I'm using a mirror with a handle. This has a rubber handle. There's a lot of different mirrors out there. I get this one from Practicon, all different sizes. But what I love about it is it does have the rubber handle. So no matter what camera you're holding, you have a little bit more stability. And I think that's really important. But as I'm putting it in, it's flat. If we come in at an angle, remember, we're going to cut off. The further we are away from the teeth, the more teeth we're going to get in the picture. And that's what I want you to really look at, is the form.
Center, and Kylie, lift your chin again, because patients have a habit of doing that. Wide, 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 wide. Do you see how I'm almost cutting off those last molars there? I want her to lift her chin a little bit higher, okay? And let me show you the difference. And I'm encouraging her, right? Wide, 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 wide. Not at an angle, flat, flat. Open, wide, 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 wide. And she does have a tiny mouth, but I got it. Good job. So you see here, I was able to really get things to look nice and straight. Probably could, if I'm gonna be real critical, pull these out, but she's young, and I really got everything that I'm looking for, right? Center the palate. That's my guide. Nice and straight across.
Make sure the team knows, what am I looking for? Nice and straight.
Grid is really nice. If you cut off these molars and they've been treatment planned, and you can imagine, my doctor's probably not gonna be happy with me.
So I'm going to come around in front now. And again, we're going to come back around. We've already got all those. Now we're going to come around, and I'm going to just take those and pull them down towards the chest. And now we're ready to get into, the lower shots here.
You notice that we've got these mirrors at a V, and I'm going to
the retractors at a V. We're going to bring them to the chest, and now we're going to put the mirror in again. Same theory. Lift your head high.
And I'm coming at the same angle, not straight across. And I'm going to have the patient just do just like she's doing, pulling those for me out of the way, okay? Making sure they're nice, again, in the right position. Now what I'm going to do is the same concept. So I'm going to slip my mirror in. Oh, that's beautiful, beautiful.
And listen, I always I tell people all the time, when you take this photo and it's bad, the patient doesn't know. Everything is beautiful. Oh, looks good. Looks great. Oh, wow, that's great. All right, one more. Looks great. Looks great. Looks great. You can't say, oh, that's not good. I got to retake. Oh, that's not good. Beautiful. Beautiful. And this is what you got to tell your team too, because patients, again, they don't know. You don't know. So we can take another one, right?
Yay.
Super easy.
Take those out.
So
you did so great. Take a look at this one.
And the one thing about the camera too is you can flip it. It can automatically flip for you. There's so many amazing things about this camera that I absolutely love. But let's talk about now that we have the photos, because what I want you to really think about, here's my added benefit to tonight. One of the things that I tell patients, even though we've done scans and now we're taking our photographs, and a lot of times we'll even do the photos first, what we cannot see in 2D black and white, we're going to see in color. And this is something that I printed out. It's yours. You can have it, but it's verbiage. The one thing in dentistry is if you give me the verbiage, I can memorize it and I'll put it in my own words. And so this is something that, again, after a while, we're not going to need this anymore. We're not going to need the guides. But one of the things that I wanted my team to do is we wanted everybody to be on the same page. So when we took the photos, we're going to start with, what am I going to say? All right, then I'm going to go to the next photo. This is what I'm going to say. And I think this is where, again, looking at that, we're going to give you these, but most importantly, you'll be able to alter them yourself because, again, we can't expect the team to remember everything. And so this is where, again, having these PDFs, take them to Kinko's, laminate them, and have them. But, again, every photo, you've got to have conversation. Again, I tell team members, you know what? I don't want you just taking the photos and you just sit there. I want you to be talking. But if you don't tell me what to say, I'm not going to ever do that. But once I know, I'm going to be really good at it and I'm going to be a great reflection of you. And so here's where, again, the conversation components come in with the images that were taken. And so one of the things that I think is important is really troubleshooting with your team. When you're taking the pictures, we're looking at everything. Why do I need this photo? First of all, you're going to tell me what series we're going to take, and we're going to take it every single time. And then you're going to tell me why, what am I looking for in the images? What do I need to make sure I capture for you every single time? We're going to capture gingiva, as much gingiva as possible. We're going to make sure, I want you to make sure that midline, you got a little cant here. Sometimes it could be the way we were standing. The other thing is when we're doing training, I videotape my team so I know how are they standing. So when I look at the images and when I download the images and we look at it and there is a little cant, well, let's go back to where you were standing. How were you standing? Where were you standing in regards to the chair? That is so important. And again, a lot of you say, well, Shane, we got small rooms. We can't really move the chair. Sure, you can. Sometimes we might need to take a lot of these photos as they're standing if your room is really small. But we need an orchestrated event. This is what I want you to do. We're going to take the full face over here, and then we're going to go to the chair. Or you're going to take your smile shots while they're standing, and then we're going to go. But systematic approach to everything is so important because then we're going to have consistent images every single time. One thing we didn't talk about was our buckle shots. And one of the things that, again, you're going to have to decide is, are you going to use mirrors for your buckle shots, or is it okay? And again, I teach a lot of Invisalign courses. We're using the Y and the C retractors. That's the clear with the Y end, and we can put those in. And one of the things that I see, because I get to see a lot of pictures of uploaded cases for Align, is the patient's not even biting together. They get tired. So this is where the team needs to understand, making sure the patient's biting. Okay, you biting together, hold it. What am I looking for? I want that canine to molar relationship, and it's a profile, flat, not a lateral view for AACD. This is a flat profile, and I can't tell you how many people don't give us a flat profile for the orthodontic records that we need. But you got to have the right retractors. If we had the C retractors and we didn't flip them to the Y, I wouldn't be able to get back far enough to be able to really make sure that I've got everything nice and straight, right? You see, nice and parallel, but I can use the retractors almost as a ruler, as a guide. So it's really important to make sure that we have those. The other thing is that going back to the retractors, I get the wire retractors. You can get those from Benko. You can get those from Practicon. You can get those from anywhere, but these mirrors come from Practicon. I absolutely love them. They have a rubber end to them, and they're really amazing, And so a lot of people will ask me, Shannon, how do we take care of the mirrors? I wrap them. Now Richmond Dental has a 4x4 it's a 4x4 gauze. I'll wrap my mirrors in the gauze, and then I'll put them into a pouch, and we put them into the autoclave. The one thing that I tell my team is, if you just put them into the pouch or you put them into and seal them up, yes, they will get scratched. And so this is where I love the fact that Richmond has those. It's just for photography. So I always recommend, wrapping them and then putting them into the autoclave. The other thing is that making sure that we have really good retractors. A good friend of mine Some of you might have even seen this case. He published this in a magazine. And then he published it online, and every person, every doctor was like, oh my gosh, beautiful case, beautiful case, beautiful case, beautiful case. Over 200 people. It was a beautiful case. But I got to be honest with you, my eyes, I couldn't get past the nasty retractors. I was the only person out of 246 people that messaged him, and I said, I got to tell you, the case is beautiful, but I can't get past these nasty retractors. You know what he said? Shannon, they're clean. What do you mean they're nasty? They're clean. They don't look it. Everything is patient's perception. And he said, a lot of times what we have is these clear retractors and they turn this cloudy look. Well, throw them away. They're $18. Or buy black retractors. The one thing though about black is it's not as pretty as the clear, but remember they're $18. We got to take good care of them. But a lot of times the reason they're turning this color is maybe we're putting them in the bottom of the autoclave and we're not putting them in the top. The other thing is that, having a good autoclave like W&H autoclave, I love their autoclaves because, when it's dry in all the instruments and you can't open the door, a lot of times we don't see this anymore. So, but if you do, throw them away. I never want a patient to think that something we're using is dirty. He said, Shannon, of all people, I can't believe you called me out. I'm like, I'm going to call you out because I want your dentistry is beautiful. I don't want patients seeing that. Contrasters. I'm really big on contrasters. It enhances the chips, the wear. I like the black. I love this. I will say that my good friend Milos, he's down in Miami now. He has his own teaching institute there. His website's called Ugly Tooth. I love his contrasters. Now, listen, if your team is not doing this yet, you could use articulating paper. You could use black construction paper. My hygienists are trained to take these photos, and they also are looking at cracks, craze lines, wear, chips, nail biters. We're looking at the incisal edges. Black, it accentuates that. And so you could take black construction paper and cut it in squares. We did it for years until your team has really taken the photos or are those images that maybe you want. But I can tell you that this is a very valuable tool and we can really enhance all the imperfections. But probably the most important thing that you're going to walk away, other than maybe thinking about that Shofu camera if you don't have it, is this. If patients are really and truly looking at you sometimes like a deer in headlights, the one thing that I will say that has made the number one difference is printing out the images. I went onto Amazon, I bought a printer, I printed out every patient. Now, here's the thing. If I'm doing the full series, which I am, I'm going to print that full series on Canon paper, and the patient is going to walk out with those photos. My doctor said, I'm not buying that. And I said, okay, well, then I'm going to buy it because I'm going to tell you right now what's going to happen. They're going to walk out. What I want you to think about is if you print something out, let's say you went to, go get your pictures taken. You took your kids, you took your dogs, you got the pictures taken, and they printed out the photo on Canon paper. Would you fold it? Would you bend it? Patients walk out with it just like this. It's almost like it's sacred. You would think that it's worth so much money the way they hold it. They're not going to put it away. When we've got a treatment plan folder, you put things away and they might not even open it. But the photo that they print, they don't have a choice. I had a patient, she said, you know what? I almost wrecked my car with the photo. Wrecked the car. This is $79.
Of our patients, we will basically open up our Shofu camera and pull out our camera card. And I'm utilizing my selfie printer, and I want you to see this because one of the things that's really important is for you to have that patient leave with a photograph. And so all I'm going to do is take the card, place it right into the printer here, okay? And what will happen is it'll pop up and show me the photos that I just took. And you can see here, right on my printer, I'm gonna come back just a little bit, you can see those. And what I'm gonna do is I'm basically gonna just kind of scroll over to the one that I know has the shade tab and the one that I really want my patient to go home with. And I am going to print that. Now, this is important because when you're talking to patients about shade and what is their shade and for them to remember exactly where it is that they're starting, because we all forget where we started. And once we whiten the teeth, we can't go back. And so this is where I want to make sure that that every patient leaves with a photograph. And when you think about that, it is on Canon paper. So again, if you're not getting yes,
to patients. Maybe you're not giving them the visuals. Maybe they were a visual and they needed something to put in their hand and they needed to see it. One of the things in hygiene, I will tell you that in my practice, when I brought in the Shofu camera, one camera, I got 7 hygienists. They wanted me to be fired. I'm not kidding. They literally told the doctor, we're not doing that. I said, we're not using an intraoral camera anymore. We're going to be taking mirror shots. More dentistry will come from the mirror shots. Why? Because the patient can see the whole arch. It forces also the team to focus on malocclusion, lower anteriors, quadrant dentistry. Again, going back to you got that single camera, you're taking photos, and patients will tell you they know where they are and they know which tooth you're talking about, but they really don't. And sometimes even we don't even really know. But when we've got a full arch, we know more dentistry. Do you know in 30 days, we had 22% case acceptance for taking the photos? Then it got to the point where we had 2 Canons and 2 Nikons, and I could hear them on the headset. We wear headsets, and they would say, "Hey, who has the Shofu camera? Who has the camera?" Well, I say, "Well, there's a Nikon. We got the Nikon in the lab. Who has the Shofu camera?" They would just, do you know now every hygienist has their own camera? I said, you get yes for your treatment plans, we'll buy you another camera. It takes seconds. Yes, it's going to take time to learn, but seconds. And let me tell you, more dentistry, more dentistry. It's not rocket science, but we gotta perfect that skill. We got to perfect it. But at the end of the day, again, if you're taking the photos, are they seeing it? Are they holding it? Do they need to look at it? And I like to print the whole series on larger paper, but I'm going to print the ugliest tooth or the one smile shot that I want them to think about. My hygienist will print out the lower anteriors with the ski soap of calculus, and the patient says, "Oh my God, I don't even want to hold that." That's what they've told us. I don't even want to carry that out. This is, oh, I just want to throw up. Guess what? We want them to throw up. We want them to see it, right? And I think that again, the short period of time we're together today, that's really important for me, for you to say, if you're going to take the photographs, do it right. Don't let your team do sloppy photos. And you don't do sloppy photos. But what you'll find, I think the team a lot of times will take better photos. But if they're not picking up that Canon and that Nikon because they're scared of it, it doesn't do us any good. And so even though we've got Canons and Nikons, my team likes this camera because it's lightweight, it's easy to use, it's touchscreen, makes sense. But you need all these things, and again, throw away those nasty retractors. I challenge you, go back to work tomorrow and you got nasty retractors, throw them in the trash and order some more. They're $18. Let's go back to some of the things that you said. What I want to look at is what did that look like? What are some of your questions? What can I answer for you? It is a short period of time, but I wanted to give you things that nobody else is really going to give you. You can learn the parts of the camera. I want you to take better photos. I want your team to have the tools to take better images. And that's really what I think is probably the most important, for me anyway, for you, is to have that. So again, looking at your polls, let's go back to some of the things that we said. Can we pull that poll back up and look at it?
Yep, just give me 1 second here.
Perfect. And please feel free to ask your questions. I'm going to tell you, I think that's really important. If you don't have, printed out for the team what questions or what photos they need, and you need my help to help you create that, I will. It takes seconds. How often are you currently taking digital photos? Well, a lot of you said never, never. Listen, all you got to do is start with 4 photos. It's not even about the camera. I just want you taking pictures. But we've got to take some photos. We've got to take the pictures. And again, it's not to shame you, but we got to take some. But occasionally also is not good. Again, put a system in place. I'm here to help you with that. What type of camera system do you use most often? Okay, the DSLR, fine. Smartphone, I'm not here to poo-poo it. As long as it stays in the practice, do not let your team use their personal phone. That's a HIPAA violation. And as doctors, you're responsible for that. So we want to make sure that there's nothing. It stays in the office. And most importantly, everybody understands those settings. And so I'm glad to see that it's about 50-50 here. Let's look at who primarily takes the photos. The dentist, the dental assistant, very low for the hygienist. Listen, more dentistry, trust me on this. They're going to say no. But what I told my hygienist is, today you're going to take x-rays. You're going to do periodontal probings. The next time you see them, we're going to take photographs. So we try to alter things. At this 6 months, we're going to do this. At this 6 months, we're going to do this. So we can take some things away. Because listen, I told you they wanted me to be fired. But when they took those mirror shots, that more patients and more dentistry came from that, oh, they were sold. We just got to train them. And you got to spend the time to train. And the photos, again, they'll perfect those. So we can do that. Okay, what kind of background? I will say that, when we think about the backgrounds, you can buy also a background. I've got it at PhotoMed. It's got a backdrop. It's black on one side, white on one side, and it's got a chain because I got a lot of ops. So I'm going to go from room to room to room. So we can definitely do that. Do you show patients their photos? Always, sometimes, rarely. This is where, again, not just one person in the office needs to be trained. There are times that my team up front knows how to take full face and smile shots and photos. You might find that somebody that maybe isn't even clinical might be better at it than anybody on your team. And again, I want everybody involved, but rarely do you show them. Why did you take them? You got to show them. We use Weave. We actually email them now. We have dummy codes when we walk out the patient. It's protocol. And let's talk about that for a second because it's something that we didn't really touch on. When my team, again, we've got the guides, everybody knows what we're going to be taking. Everybody has their own camera card and they're responsible for it. And it's protocol that when we take the photos, we got to download it. We can't just walk out of the op. We're going to download it right there. And put those patients in. I'm going to take a picture of the patient's name. We're going to take the photos and we're going to take a picture of the patient's name again. We're only as good as the person that trained us. And this is why it's really important. Because we're going to run on teeth. The other thing is that if they don't ever download it, you're going to be like a good friend of mine down the street that called me last week to ask me, can he borrow one of my camera cards? I said, why do you need to borrow my camera card? Don't you have more than one? No. Oh my God, that's the stupidest thing in the world. Every team member needs their own camera card and they're responsible for it. And they've got to download those images because, again, we're going to forget what we did. Photography takes us everywhere, but if we don't have the systems, we're going to have those run on patients, right? And we need to go back and look at this is where we were at the prep. Here's your provisionals. Shannon, I don't like the provisionals. Okay, but the lab's going to do better. But this is where we're going to take our photos. Communication with every step of the way. But if we never show them, that makes me sad. They got to see it. So not only are we going to email them, we're going to text them. We got Weave, we text them, but most importantly, I can send them to them right there. So it's the beauty of having a camera that you can hurry up and take those photos and do. The type of photos that have the greatest impact, smile, close-ups, absolutely. A lot of times people don't really want to see that retracted view. They want to see the smiles, befores and afters. But for me, at the end of the day, I want to show patients, here's where you were. Do you remember where you were? Look at where you are now. People want to see people. People want to see your dentistry. It's important. I'm going to harp on you with that. The ideal focal distance, again, 1 to 2 inches. For me, I just want you to get the smile in the frame. I don't want you to cut off the corners. And again, level. I want quality images, not a can't. There's not a little man in there either that's going to take that photo that maybe is blurred and make it perfect. So this is where the team has to understand there's not a little man in there that's going to take that blurry image and make it perfect. So unless we hear the beep beep from whatever camera we're using, including the Shofu, it's not in focus. So we need to make sure of that and making sure that if we wear glasses, put them on when you're taking the photos, right? And then what's the most step that's overlooked? The retractor positioning, totally 100%. Because when the retractors are in, they've got to be right. You saw when Kylie put the retractors in, she's going to grab them like this and hold them and nice and straight across. Most people, when you put in retractors, they want to do this. Why? Because it's starting to stretch their lips and they don't like it. And I'll say, listen, I want you to take those retractors and pull them out. But remember, do these people stay with you or they just come and see you one time and you never see them again? We got to train them. This is what we're going to be doing every single time. You know what to do. You know what to do. And that's what I tell them. Okay, here you go. You can put these in yourself. I joke about it. But the one thing about photography is it's very intimate. People will tell us more when we're taking the photos. We can ask questions. We can move along. But most importantly, this is how we're bonding with these people. And that's the most important thing. More treatment will come from the photographs than anything else you could do. But when you print them out, it's even more. So I want to see you go and get that printer too. But one of the things, again, I want to go back to any questions tonight. It's been a long week. I know you have those, but one of the things that I want to make sure is that, I'm here for you. Again, understanding occlusion, why are we taking it? Having the assistants, the hygienists, everybody on the team, we're taking photography for a reason so patients can see this. And I want to make sure that you have that. You can email me. I'm more than happy at any given time. It's super simple. It's just Shannon at Chairside Assisting. Shannon at Chairside Assisting. If you don't have the guides, I'll help you with that. If you want to see the guides that we've made, we've got all different types. But I will encourage you that if you like what you saw today, we trained every Shofu rep. They know how to take the photos, they know how to position the patient, and they know exactly how to do these images. And so I always recommend get them in there. Bring the camera. If you haven't used it, you don't have a camera, bring it in and let the team use it. Take the photos, go through some training with them. I told you, when they put it in their hands, they absolutely love it. But when they really take the photographs, more dentistry will come. And you didn't have to pay me to be your consultant to tell you that. So again, really important. I thank you guys so much. I know it's just a short period of time, but if you need me, I'm here for you. Shannon at Chairside Assisting. And again, I want to see those images. I want to help you be better. And most importantly, making sure you've got the guides. So I can't thank Catapult enough for having me and Shofu for letting me talk about something that I love so much. Can't do without it. So one of the things that I see here, just a couple of questions here is, what do you use for background when taking full face of the head? That was that from Photomed, that black flip, white and black on the back. What camera would you use to take pictures of the oral pathology lesions? I love that. Shofu, you have so many modes. The one thing we didn't talk a lot about was the parts of the camera. They have a surgical mode that actually enhances surgery, red, the beautiful colors of red. What are we looking at? It's made just for surgery. My periodontist, he was doing all this surgery. I said, oh my God, you got to have a Shofu camera. That's what it was made for, really, was surgery first. So this is the beauty where we can really enhance a camera that was made for dentistry, not just for everything else. So love that question. The second thing is how and what do you advise for buccal quarter shots? Love it. The Y retractors. Or you could use wire for buccal and use a buccal mirror. But what we found is we were able to get first molar, pull it all the way back. But again, it's the Y end, right? It's got to have the C on one end and the Y. And they're long, not short, squatty retractors. They're really long so they could take it, pull it back to their ear. And then this way I could get almost back to the second, sometimes, past the second molar. So I do like those. Do you use mirrors for buccal quarters? Yes, we do. If we're really got to get back there, and especially patients have third molars, we will. And I'm going to buy those from Practicon and really put that in. And this is where you're going to come in at an angle. You remember, we're going to shoot into the mirror, but I want a really nice mirror I can hang on to because we're going to hang on to it and pull it out. Now, I will say that there are some really nice mirrors that slip into the mouth that Photomed has. Slip into the mouth and they pull it out like this, and you can actually shoot right in. And it's almost like an L shaped. So again, got to find the really good ones. What retractors do I use? I use Photomed for pretty much everything, but I will tell you, I've seen them in Benko, I've seen them in Shine. I like the Y end with the C, and then I like the wire and the mirror for the mirror shots. You can't use those for that. But I will say that Milos is uglytooth.com. It's uglytooth.com. He's the one that has some really beautiful black retractors. You don't want to buy them on Amazon. They're cheap, and you put them in the autoclave, they're going to melt. You really want something that's going to last forever because they're made of really heavy metal. And again, if you don't have that link, you can email me, Shannon at Chairside Assisting. I'll help you through that. What's the cost of the Shofu camera? Great question. They're running specials tonight. So you're going to get that. Special. And then how do you know when the Shofu camera is in focus? Beep, beep. It's going to beep. It's going to tell you. Again, you got to hit the button to light it up. It's very different than other cameras because it's got LED, and I love that. I hit it, and then that way it's going to start lighting the mouth up for me, and we're going to move our body in. But most importantly, it's going to beep, beep. It tells you when it's in focus. So again, it's just like, the Canons and the Nikons. It's going to let us know. You just got to listen for it. Is the Shofu very accurate for shade tab shots? Okay, one mode we didn't talk about was the isolate mode. Bob Lowe will tell you right out of the gate, he had 7 cases, almost back-to-back, single teeth, That's the hardest thing to do is one tooth, the hardest thing. If you turn it to the isolate mode, it'll take out the red, and this is where we're able to see shades of gray. And this is the beauty of having all these modes that we didn't really get a chance to go into all the modes. But I will tell you that one of the things that when we showed our dental lab, now Bayview, my dental lab, they've got Shofu cameras. Why? Because of that. Because the hardest thing to do is to see and do one tooth. So absolutely, this is what is so great. And you got an older model, and you gotta get a new one. Plus, it has video now. We can videotape patients and what they like about their teeth and what they don't like. And having the video even for the lab, man, that bumps it up to a whole nother level. Now the lab gets to see the patient, they get to hear them, but they also get to see the photos and they're in video. So now Shoji is making teeth for a real person, photographs, but also hearing them on video. But if I can help you with anything, let me know. Thank you so much for your time tonight. And again, it's Shannon at Chairside Assisting. And thank you again for Catapult and Shofu for having me.